So let's study about IMNCI. This is the logo of IMNCI, which is Integrated Management of Neonatal and Childhood Illness. This present slides are taken by the Arpit's PSM classes that is available free of cost in YouTube. As well, I added from Arun Babu few treatments which is there in pediatrics. So let's start about IMNCI. IMNCI is an Indian version of IMCI. There was IMCI, which is created by the WHO and UNICEF. That version, that IMCI, Indian version is IMNCI. Here in India, neonate is included. Major IMNCI adaptations are like before it was IMCI, but India has made it as a IMNCI. Then what extra the India has adapted to make it as IMNCI? So that is what they are talking here. Major IMNCI adaptations include early neonates, that is 0 to 7 days of age, that is early neonate. Emphasis on a sick neonate as compared to the sick older children. Suppose let's say a baby is born here, okay, this has passed 7 days, 1 month, then 1 year, right? After that some few years, okay. Now IMNCI includes this birth to 7 days old children, old neonates, that is called as early neonates, and it also puts emphasis on sick neonates rather than older children. Suppose a child is there, okay, a neonate is there which is sick, which is less than less than 1 month, and there is older child who is grown up and he is also sick. Now the IMNCI makes emphasis on this sick neonate as compared to the sick older children. So it mainly concentrates on neonate. That's why it is IMNCI, that means neonates. Incorporating national guidelines on malaria, anemia, vitamin A supplementation and immunization. So national guidelines for malaria, anemia, a supplementation of A and immunization schedule. This I have remembered as MAI, or you can remember it as Mia also, okay, Mia bhai, so like that you can remember. Incorporating national guidelines on malaria, immunization schedule, anemia and vitamin A supplementation, and training the health workers. So you have seen the 0 to 7 day neonate, then till 28 days the neonate is emphasized more, sick neonate, and then after that you have seen the malaria, anemia, immunization and vitamin A supplementation national guidelines, and then all the neonates are there. But if a health worker is not good, then nothing makes sense. So that's why training this healthcare worker is also included in the IMNCI. So that's about major adaptation, that is 0 to 7 days neonates, early neonates, that is sick neonates emphasis, and malaria, anemia, MIA, that is malaria, immunization, vitamin A and anemia national guideline emphasis, incorporating the national guidelines, and then training of the health workers. According to the IMNCI, young infant means less than 2 months of age. Coming to the IMNCI, which is original by the WHO and UNICEF, developed by WHO and UNICEF, as we have discussed above in the starting of the chapter. Target children are less than 5 years. This 5 years is divided into two group sets, that is less than 2 months and 2 months to 5 years of age. So according to this only the treatment is also it goes on. 3 strategies of IMCI, that is case management, skills of the health staff, then improvement of the health system, then improvement in family community health practices. How do you remember this? See, first is a patient, right? This is patient. He comes to the doctor. He comes to the doctor who is wearing this nice stethoscope. He is a doctor. Okay. This doctor is working in a hospital, which is a system. Okay. So the strategy is that improvement of case management skill of this health staff, improvement of the health system, and improvement of family and community health practices. The improvement of the family and community health practices comes here, then improvement of the case management skills of a health staff, then improvement of the health system. I think you can now imagine this whole scenario and 3 strategies, along with the patient coming to the doctor and doctor is working in the hospital. So that story. Coming to the components. So IMNCI has 2 components, that is preventive component and a curative component. Preventive components are breastfeeding, nutritional counseling, vitamin A and iron supplementation, immunization and helminthic infestation. Treatment curative are integrated case management of the most of the common childhood problems like diarrhea, measles, malnutrition, ARI, that is acute respiratory illness, pneumonia and malaria. How do you remember this? See, IMNCI has 2 components, preventive and curative. Preventive, you can imagine a diagram. Actually, this is a shoulder and this is a waist. This is also hand and this is a chest, and these are the 2 limbs, rather buttocks. Okay, this is the picture, and by this picture you can remember on the shoulder there is this injection will be put, that is immunization, and at the chest you can remember breastfeeding, and in the belly you can remember INA, that is iron, nutrition and vitamin A, because stomach will be in the abdomen, right? So that's why I segregated it as a iron supplementation, nutrition and vitamin A supplementation. And since it causes diarrhea, so helminthic infestation there in the diarrhea cases. So that's how I pictorially remember. Now the curative component can be remembered by the DMMAM, DMMAM. So the DMMAM diseases are diarrhea, measles, malnutrition, acute respiratory illness and malaria. That these 5 integrated case managements are very important. Now we are telling that the case management is there. These are the cases and these should be managed. So how do we actually manage these cases is what we study here. Case management steps. This is first the child will come. So as we have discussed above, this is patient, this is a doctor and he is working in a hospital. Okay. Now the child will come to the doctor. We have to assess this child and classify the illness, whether this patient has got this illness or this illness. Now identify the treatment and start treating the children in the hospital, then counsel the mother and follow up care. So the case management steps are assess, classify, identify, treat and counsel, follow up. Okay, see, these are the 6 steps. Now assessing the child we will discuss here in these things. Then classifying the children is we discuss here. So these are the 2 points that are discussed in the next slide very detailedly. Identifying treatment will be discussed in this slide. Okay, identify and treatment as well as counsel of the mother and follow up care. That doesn't require any of the discussion, I feel. So we just ignore this one and we concentrate in the first slide these 2, and then next slide identifying and treating the child. Now coming to the assessing of the child. In the OPD basis, check for the danger signs and assess the main symptoms, assess the nutrition and immunization status, ask the mother whether the child is immunized or how is the nutrition, how are you feeding this child. So that is what the assessing of the nutrition and immunization status mean. Check for the danger signs. What are the danger signs? Inability to breastfeed and persistent vomiting, severe malnutrition, lethargy and convulsion. How you can remember is a story kind of thing. See, the here child is there, it's not feeding, so inability to breastfeed. Since it is not feeding, sometimes it is puking out, that is vomiting. Since it is throwing up all the things that have been consumed, that's why it is malnourished. Since it is malnourished, it is inactive, that is unconscious, lethargic. Sometimes the slept child presents with the convulsion. So that's how you can remember the danger signs. Coming to the assessing of the main symptoms, signs, remember, signs is illustrated by the doctor and symptoms are what the patient will tell to the doctor. So these are the patient, what the patient is telling is that I have fever, I have ear problem and I can't breathe, I have so much of diarrhea. So the patient's mother comes with the baby's mother comes with the baby that my baby is having a very high grade of fever, he is not able to breathe and he is he is having diarrhea also. When I am giving a signal, he is not responding to my signal, that is ear problem. So here pictorially you can remember that fever, ear problem, otitis media, breathing problem and diarrhea. So these are the main symptoms. Danger signs, main symptoms, assessing the nutrition and immunization status. Now coming to the classifying of the illness. How do you classify? We classify it as a pink, yellow and green, not the red. Okay, in all the triages we classify it as a red, yellow, green. So here we just classify it as a pink, yellow and green. Pink means urgent referral is needed, IPD admission is needed. Yellow means treatment on the OPD basis given the oral drugs. Green means home based management, can be treating the local infection at home only. Now we have discussed assessing the child, we have discussed how to classify the child, that is pink, yellow and green. Coming to the identifying of the treatment and treat the child. How do we identify the treatment and treat the child? For all the infants, before referral, before you are referring the patient, you have to prevent the hypoglycemia by giving the breast milk or a sugar water, then warming the young infant by skin to skin contact, that is KMC, kangaroo mother care. After this you can refer the patient. Now urgent pre-referral treatments are, in the case of the severe pneumonia you can give oral amoxicillin or injectable chloramphenicol. If you ask me, this is oral amoxicillin is better. Severe pneumonia, oral amoxicillin. Very severe febrile illness, you can give one IM injection of quinine and then make a blood smear for malaria. To rule out the malaria, you have to make a blood smear, then first dose of chloramphenicol or amoxicillin, then paracetamol. So any febrile patient, if it is febrile, then you have to give the PCT. Since it is very severe, we will give the antibiotic, that is amoxiclav, and it is, since it is very, so that's why we will give IM, that is quinine. Since we are suspecting the malaria, we will make the blood smear. Clear? Okay. Next one is severe complicated measles. Wherever the measles comes, A means vitamin A, then give the amoxicillin since it is severe and complicated. So that's why amoxicillin, tetracycline eye drop. If it is mastoiditis, then amoxicillin you have to give, then paracetamol. Severe malnutrition is there, then vitamin A single dose is needed. So this is the pre-referral treatment to 2 months to 5 years of child. Now coming to the other treatments, that is possible serious bacterial infection is there, then you can give intramuscular ampicillin or gentamicin. Severe dehydration is there, we have to follow the plan C, that is IV fluids immediately we have to start. We have to give ORS if the child can drink. Otherwise IV fluid, that is 100 ml per kg of Ringer lactate solution or normal saline. See, plan C means what? C means injectables. What injectables we can give? 100 ml per kg of ringer lactate or normal saline. Along with that we can give ORS, okay, if the patient can take it, the child can take it. Suppose instead of severe dehydration there is only some dehydration, means plan B. Severe dehydration plan C, some dehydration plan B. Plan B means what? Just ORS. No dehydration is there, plan A, that is just give the oral fluids, feeding and educate the mother. Severe persistent diarrhea is there, then what you will give? Ampicillin and gentamicin. Jaundice, home based care, educate the mother, follow up in 2 days. Difficulty in feeding, that means just check for the candid and advise mother to treat against the candida, that is thrush, and follow up in 14 days. Coming to the treatment of the sick child, 2 months to 5 years. If pneumonia is there, amoxiclav you give, soothing of the throat and follow up in 2 days. No pneumonia, just cold and cough is there, soothing, educate the mother, 5 days follow up. Some dehydration is there, plan B. No dehydration is there, plan A. Severe dehydration, plan C. Okay. Persistent diarrhea is there, then give vitamin A and oral zinc sulfate. Zinc sulfate, how much? 20 mg at night for 14 days. For 14 days. Okay. Then malaria case, oral antimalarials, blood smear you have to make, paracetamol you have to give since it is fever is there, educate the mother, follow up in 2 days. Fever is there, but unlikely it is malaria. That means you just have to give paracetamol and follow up in 2 days. Measles is there with eye problem or mouth complications. Vitamin A you have to give, eye problems, tetracycline, and mouth problems, gentian violet, follow up in 2 days. Measles is there, A for vitamin A. Chronic ear infection is there, dry the ear, don't make it wet, follow up in 5 days. Very low weight is there, feed the child, follow up in 30 days. Not very low weight, that means moderately weight is there, then counsel the about the child's feeding and follow up in 5 days. Anemia is there, then iron folic acid therapy for 14 days, then follow up in 5 days. If feeding problem is there, if no feeding problem is there, follow up in 14 days. No anemia means give the prophylactic iron and folic acid tablet, 6 months or older, more than 6 month child. So that is about the identifying the treatment and treating the child. So first in this slide we have discussed class assessment and classification. In the later stage of Arun Babu book we have discussed identify the treatment and treat the child. Counseling and follow up we just have to write in the case management step. Let's just revise quick. IMNCI logo, it is originally it was IMCI, that is developed by WHO and UNICEF. Indian version is IMNCI, N means neonatal. So what are the major adaptations? 0 to 7 days neonate is included. Sick neonate is prioritized, emphasized more than the older sick children. Then national guidelines incorporating for malaria, anemia, vitamin A supplementation and immunization schedule, training the healthcare workers. Now coming to the original IMCI, there are targets less than 5 years child is treated under the IMCI. That is divided into less than 2 months and 2 months to 5 years. 3 strategies are there: management skill, health system, okay, health practices. So as we have discussed that this is the patient, this is the doctor, and doctor is working in the hospital. So regarding the doctor, health system; regarding the patient, health practices, community health practices; regarding the hospital, that is case management, health system; and regarding the doctor, case management skill. Pardon me, one more time, I just made it some wrong here. So first of all, regarding the patient, here the patient is there, doctor is there, here the patient is there, he comes to the doctor is working in the hospital. So regarding the patient, the improvement of the family community health practices; regarding the doctor, improvement of the health, improvement of the case management skills; regarding the hospital, health system improvement. Now IMNCI have 2 components, preventive and treatment component. Treatment component is DMM, that is diarrhea, measles, malnutrition, ERI and malaria. regarding the preventive, there are 5 things, that is from here deltoid you can remember immunization, from here breastfeeding, INA in the abdomen, iron, nutrition and vitamin A supplementation, from here diarrhea, helminthius infestation. So DMM here, then case management steps for these diseases. Case management steps, that is assessing the child, classify, identify the treatment, then treat, counsel and follow up. Assessing and the classify we studied in the next, that is danger signs, assessing the main symptoms and nutrition immunization. Danger signs are the inability to breastfeed, persistent vomiting, malnutrition, unconscious, convulsions. Assessing the main symptoms, that is the fever, otitis media, difficulty breathing, diarrhea. Coming to the classification, that is pink, yellow and green. Pink is IPD, yellow is OPD, green is home based management. Coming to the management, actually this part here, identify the treatment and treating the child. Here we have discussed about the pre-referral and referral. So various conditions are there. Quick. If plan A is there, no dehydration means plan A, that is feeding and fluid, educate. Then some dehydration means ORS you have to give, plan B. And severe dehydration means IV fluids you have to see, plan C, that is 100 ml per kg. Ringer lactate, bacterial infection is there, intramuscular ampicillin and gentamicin. Severe persistent diarrhea is there, ampicillin, gentamicin again. Jaundice means home based treatment, follow up in 2 days. No dehydration means plan C, that we have discussed. Plan A, difficulty in feeding is there, then the treat for the candida by the mother, follow up in 14 days. Pre-referral, severe pneumonia is there, just give amoxicillin and refer. Very severe febrile is there, febrile means paracetamol you have to give, severe is there, that's why amoxicillin you have to give, very is there, so that's why quinine you can give, that is very severe febrile illness. Severe complicated measles, since measles is there, vitamin A, since it is complicated, amoxicillin, tetracycline, eye drops, ointment, eye discharge if it is present. Mastocytitis, amoxicillin, since it is very infective, that's why amoxicillin. Since there is fever, paracetamol. Severe malnutrition, vitamin A. Sick child means pneumonia is there, amoxicillin, soothing the throat and follow up in 2 days. No pneumonia, just cold and cough is there, soothe, educate and follow up in 5 days. Some dehydration is there, plan B. No dehydration, plan A. Persistent diarrhea is there, zinc sulfate you have to give, vitamin A you have to give, follow up in 5 days. Malaria is there, blood smear you have to make, anti-malarial drugs you have to give, paracetamol, educate, and less than 2 days you have to ask the patient to follow up. Coming to the fever is there, but malaria is not suspected means that give the paracetamol and follow up in 2 days. Measles is there, vitamin A, tetracycline eye drop and gentian violet. 2 days follow up. Measles means vitamin A. Chronic ear infection is there, dry the ear, follow up in 5 days. Very low weight is there, just feed the children and follow up in 30 days. Anemia is there, iron folic acid tablets for 14 days and follow up in 5 days. If feeding problem is there, no feeding problem means follow up in 14 days. So that is all about IMNCI. Lastly, I just want to touch upon the facility based integrated management of neonatal childhood. This is FIMNCI, not IMNCI. This is integration of IMNCI package and facility based care package, both together. Added components are asphyxia management and sick newborn, care of the sick newborn. Helps in skill building of the medical officers, staff, nurses. Posted in facilities to manage the newborn and childhood illness.